March, of course, Colorectal Cancer Awareness Month, and early detection is essential. Colon cancer is the second most common cause of cancer deaths here in the United States.
So this morning we're going to talk about some of the screening options available. Dr. Cedrek McFadden, a board-certified colorectal and general surgeon, is with us. Good morning, Doc.
Good morning.
Good to see you. Okay, so the American Cancer Society just releasing new numbers yesterday. Although there is a decline in colorectal cancer numbers, there's an increase in people younger than 55.
Yeah.
What explains that?
So the short answer is we don't exactly know what causes that. However, there are some things that we know can influence it. Obesity, poor eating, excessive alcohol use. But listen, I have some patients that are very healthy and still develop colon cancer. So it's not just that. I think it's something environmental that we have to expose as well, and how that can influence the gut microorganisms or the microbiome. But still, the jury's out on it, but a lot of research going into this exact topic.
Let's review some of the screening options, and we'll start with perhaps the most well-known, the gold standard probably, I would imagine, the colonoscopy, the old-fashioned colonoscopy.
Yeah. Well, most people think of it. When you think of colon screening, you think about having a colonoscopy, and it's a great test. It's very sensitive to find cancers and polyps, and it's done if average risk and if it's normal every 10 years. And that's really the great part about this particular test. The advantages is this is one-stop shopping.
Yeah.
You're going to search, you're going to find, you're going to biopsy, potentially remove, all in the same session. Some of the downsides, as we've talked about before, are the prep. You do have to prep the day before. You do have to take time off from work. It's an invasive procedure, and there are some potential complications that you could have from the procedure, but still a great test.
So for people who, I've asked about this before, these at-home kits, I years ago thought they weren't as good, but it sounds like the technology has gotten a bit better, right, with these home kits?
Yeah, so there are some baseline rules we have to establish.
Okay.
First of all, that if the person has any family history of colorectal cancers or polyps, if they've ever had colorectal cancer or polyps themselves, or if they're having symptoms, the bleeding, change in bowel habits, belly pain, changes in weight, these are not the tests for you.
Doctor, absolutely.
You get the colonoscopy. This is not the test for you. Okay. But the home tests are great options, and there are a couple of different options. Obviously, we talk about the Cologuard. That's the test that checks for not only blood in the stool, but also abnormal cells in the stool. That is an at-home test that's done every 1 to 3 years. And its sensitivity approaches that of colonoscopy, almost 92%, which is pretty good. And it's done in your home.
Yeah.
So you're not taking time off from work. It's convenient. The downsides and some of the disadvantages is there is a false positive rate. According to Exact Sciences, the company that produces it, about 13%. And so for people that have a positive...
I'd still take those odds.
And those are still odds that we accept.
Yeah.
However, but for people who get a positive test, they come into my office as Dr. McFadden, do I now have cancer? I have to kind of pause and then say, well, let's do the colonoscopy. And some of that anxiety could be the disadvantage that we don't want to see.
What about the future of screenings, CT scans, blood tests? Where do you see it going?
So the CT colonoscopy or the virtual colonoscopy, that is what we currently have available in most places now. And most people like that because of the fact that it's fairly easy, right? You do have exposure to radiation, which is a side effect, and you still have to do a bowel prep, and it can be a little bit uncomfortable. But it is another potentially non-invasive way that you can be screened. And the blood-based testing, that is FDA approved, but not currently recommended by the United States Preventive Task Force. So potentially, as more research comes in 5-10 years, that may be a different conversation that we could be having.
Doctor, who should be thinking about getting screened, and what should they be looking for as far as any sort of symptoms?
Right, so there are two ways in which we find colon cancer. Either the person has screenings or they have symptoms. Right?
If you have symptoms, is it too late? Or can you know what I mean? Like, I'm hearing about all these young people, young men, who are being diagnosed with colon cancer.
It's not necessarily too late, but it generally means that something could be a little bit more advanced.
But how would they have known?
So we don't, because symptoms start and often they're disregarded. So we don't want people to ignore symptoms. And we also don't want people to wait to have symptoms. We want people to be screened. We want screening to begin at the age of 45 or sooner if you have a family history or if you're high risk. And additionally, regardless of your age, if you have symptoms, get a test.
All right. Dr. Cedrek McFadden, thank you.
Thank you so much.
Thanks so much. And for more information on colorectal cancer awareness, check out our website at today.com/health. Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.